Welcome to Health Champ, your source of a wide range of health tips and hacks. On August 28, 2020, King Titchalla of Wakanda, Chadwick Boseman, passed away after battling cancer of the colon for 4 years. While we all know that the vitality he showed in Black Panther were all an act, it is no doubt that the real person behind the mask was one that was full of strength and vigor. How can the Black Panther die? If such a strong man can succumb to this disease, then it must be a fatal one. There is, however, a good chance of successfully treating and curing colon cancer, most especially when it is localized to the colorectal area. Therefore, early detection is key to a successful treatment. According to the National Cancer Institute, surgery is the primary form of treatment and results in cure in approximately 50% of the patients. It is therefore paramount that it is detected early. Knowing the signs and symptoms of colon cancer is essential to arresting it during its early stages. In this video, we discuss the signs you need to look out for if you are worried about your colorectal health. Here are 8 signs and symptoms of colorectal cancer. Number 1, narrowing of stool. Always check your stool. When it comes out so much thinner, there could be a growth in your colon which could be the cause of the narrowing of the bowels. If this lasts for more than 4 days, consult your doctor. Number 2, continual change in bowel movements. Always check and count the days when you cycle through persistent changes when passing stool. How often and long do you get constipated or have a loose bowel movement? While your bowel movement habits may directly be affected by your most recent diet, it could also indicate the presence of a large colon polyp, which is a clump of cells that are almost always benign, but can also develop into cancer. It is best to record what you eat and what your stool looks like over a period of time, most especially when you cycle through the changes persistently. Number 3, cramps or painful defecation. Pain is a gift that alerts us if something could be going wrong. If defecating is painful, or you experience intestinal cramping over a period of days, it's not normal and it's best to consult your doctor. Number 4, rectal bleeding. While hemorrhoids can cause blood on your stool, it is also a telltale sign of colon cancer, especially when there's a lot and when it persists. Don't fret, rectal bleeding is actually quite common. But don't be complacent either. If you find blood on your stool, take note if you feel any of the other symptoms and signs enumerated here. Also, take note of how long has this been happening. If it's persistent, it's time to get screened. Number 5, unrelieved bowel movement. If you find that after emptying your bowels it doesn't feel like you've done so, it could be a sign of colon cancer. If you've been feeling this for over a few days already, it will be wise to consult your doctor immediately. Early detection is key. Some colorectal cancer patients say it also takes them so much longer to pass stool. So take note of how long before you can empty your bowels and compare that to your usual. Number 6, weakness or fatigue. We all get tired and experience weakness and fatigue, but when this is worse than usual, or when it's easier and faster for you to feel empty of energy, it may mean that an abnormal cellular growth in your colon could be bleeding. Check your stool if it's stained with bright red blood. This color suggests it's fresh and is in the colon and rectum area. Also, check if you have any of the other symptoms we discuss here. If it comes with one or several of the others, consult your doctor immediately. Number 7, sudden weight loss. Cancer cells consume your energy and may also be triggering the body to respond in such a way because abnormal cellular growths in the colon can greatly affect a person's metabolism. If weight loss happens too fast and too sudden, it can be a sign of cancer. Obstructions in the colon area can also impede your regular digestive process. Number 8, sudden loss of appetite. This is chicken and egg scenario with sudden drop in weight. A patient could lose weight because of the altered metabolism that causes discomfort, which could be causing the decrease in a patient's appetite. This decrease in food intake, in the same way, could trigger the weight loss. But note that, nothing that happens suddenly and persistently is quite normal. If it doesn't feel right, trust your body and consult your doctor immediately. Thanks for watching. If you learned something new, please hit the like button below. For more health tips, tap or click the subscribe button. While you're at it, ring the bell button to get notified when we post new videos.